Hi there, my name's Cole and I'm a pharmacist. How can I help you today?
Well, I was sort of hoping you might be able to tell me I could go home.
Okay. Sure, let's talk about that a little bit. So how long have you been here?
Oh, my wife brought me in last night. That pain I was having was just terrible.
Okay. Where were you experiencing the pain?
In my back.
In your back?
Yeah.
In your lower back? Or?
Right, actually, in the lower back would
Okay.
be it.
Okay.
And it was really, really bad. And, I don't want to take any strong painkillers, but I'm willing to try anything right now to get rid of this pain.
Okay. Let's talk about the pain a bit. I mean, what precipitated it? Did it just show up out of nowhere, or did something
Well, I
happen?
guess
An
so,
injury?
but I've got prostate cancer, and my cancer spread now.
Okay. How long have you been living with prostate cancer?
15 years.
For 15 years.
Yeah.
Okay. And up until now, it hadn't spread to any other part of the body, as far as you know?
No.
Okay.
I was okay with it. I've had it for 15 years, so I was able to live with that. But I'm getting a little concerned now too because it spread, and I'm worried about my wife.
Of course.
She's going to be all alone.
Well, I can understand how you'd be a little bit scared at this point.
Yeah,
But,
I am.
let's take it step by step and maybe determine ways in which we can make your quality of life for the time being better. And, make it easier for you to enjoy the time remaining you have with your wife.
Okay.
So, the pain itself, were you told whether or not it spread to the kidneys, or did it spread
Just to my bones,
just to your
my
bones?
back, my lumbar spine,
Okay.
my ribs.
Okay. And if you were to describe the intensity of the pain on a scale of 1 to 10, what would you say it is? 10 being the worst pain you've ever felt, 0 being no pain at all. What would it be on average?
Last night when my wife brought me in, and it was a 9.
It was a 9.
Yeah, it was really, really bad.
Okay. And now I understand that they gave you some medication for pain.
Yeah, they gave me some morphine.
And how's that been helping for you?
Oh, it's really good. Yeah.
Okay.
Yeah.
And so after you took the medication, what would you say the pain level was out of 10 again?
2.
It was about a 2 out of 10. Okay.
Yeah.
So would you agree that the medication is pretty effective for control?
Oh, yeah, but I hear that stuff's pretty addictive, and I don't want to become a drug addict.
No, I understand. Now, keep in mind, it can have some addictive qualities to it for individuals who are using it over a very long period of time, who end up becoming. It's addiction and physical dependence are two different things. Addiction would be a willingness to want to take the drug for the euphoric effects of it without a real dependency for it or a need for it. In your case, you may develop a physical dependency in which your body depends on the drugs to reach a certain level of balance so that it doesn't feel as much pain and you're functioning on a more normal level. So mental addiction is one thing and physical dependency is another.
Well, I'm going to take something for the pain, that's for sure, yeah.
And it's important to be cautious with these medications, of course, but they're also very useful in many circumstances, such as in yours, when you're dealing with this intense type of pain. Okay. So what we would like to do is manage it closely with you. Keep an eye on your pain and make sure that we're not over medicating you, and more importantly, we're appropriately treating your pain. So let's keep an eye on it, and if you feel like the dose is maybe too high or too low, you let us know, and we'll continue to be diligent in monitoring.
Well, as long as we get something to take care of the pain, yeah.
Absolutely.
Yeah.
So besides prostate cancer, do you have any other medical conditions?
Yeah, I've got some hypertension.
Okay. And how many years have you been living with that?
15 years.
15 years?
Yeah.
Okay. And typically when you do take your blood pressure or have it taken, what are the readings like?
Oh, I don't know. My wife sort of looks after all of that.
Okay.
And that's another thing too, she's always looking after me, and now she's, if something happens to me, she's going to be all alone, and I'm really concerned about that.
Yeah.
I'll have a tough time.
Understand, and it's a hard situation. But let's take it day by day and see if we can make it as easy as possible for you. I'm here to help you in any way possible. And just if you have any questions or concerns throughout the entire process, just go ahead and ask.
Good, thank you.
So as you said, going back to the hypertension,
Yeah.
you weren't really sure what the readings typically were?
No.
Okay.
No.
Have you been taking anything for it for the past few years?
Yeah, I've been taking medication for the last 15 years.
And do you know what you were taking?
My wife would know, so I had her write it out for me.
Okay. Oh, great. Thank you. Okay, so for your hypertension, you're on a medication called hydrochlorothiazide.
Okay.
It's also known as a water pill. You may have heard that term before.
Yeah.
So, as far as you know, has it been effective for you?
Oh yeah.
Your blood pressure's
Yeah.
been controlled
Yeah.
well?
I
Okay,
think so.
okay. Um, okay, yeah, and this medication tends to work by decreasing the amount of fluid that's in the body. That's why they call it a water pill. It tends to make you pee an awful lot, and subsequently you lose fluid, and hopefully your blood pressure drops, and that's kind of the idea behind that one.
Okay.
So besides your hypertension and your prostate cancer, and I'll also notice you have osteoarthritis.
Yeah, I've got. I take something for my knees.
Okay. And is that the Tylenol that you take for that?
Yeah.
Okay.
Yeah.
And are you still currently taking it since you've been in the hospital?
Yeah.
Since you've been on
Yeah.
the new pain meds?
Yeah.
Okay. And how's your pain been controlled for your arthritis?
It's okay.
It's been
But,
good?
it's not that bad.
Okay. Okay. And you also take an aspirin,
Yeah.
81 milligrams a day.
Yeah.
What are you taking that one for? Do you know?
I don't even know. I've just been taking it for years and years.
Okay. Is maybe something the doctor tacked on for you?
Could have been.
Sure.
Yeah.
Okay.
Yeah.
Have you had a previous history of a heart attack or a stroke,
No.
perhaps?
No.
Okay.
No.
Often we see this medication used for prevention of those two particular indications.
Oh.
It,
I don't know.
it can be used to stop the blood from clotting too much and hopefully work to prevent a heart attack or stroke in the future. For seniors, often you see it on the regimen quite frequently. Overall, out of all the medications that you're currently using, any negative side effects or anything
No.
out of the ordinary?
No, I've been taking them for quite a while, and everything seems to be working okay.
Okay. I haven't gone through this one yet. The Leuprolide,
Yeah.
you're using that one for your prostate cancer. Every 3 months, is that
Right.
correct?
Yeah.
Okay. And now, if I recall, that's an injection, right?
That's right.
Okay. And any weird side effects after getting the injection, or?
No.
Okay.
No.
Okay. So if you were to mention one concern with this whole process today, with what's going on, what would that be? What would be your primary concern?
Well, just.
Well, I mean, I know you mentioned your wife.
Yeah, well, that's what I'm really worried about. Is that she's going to be alone. We have no kids, and
Have they given you a timeline? Any sort of idea of how long you might have, or?
I mean, how long I'm going to live?
Mm-hmm.
No, but they. I guess because of the pain, I guess something's going to happen.
Mm-hmm. And did they mention to you what that pain now means? What the cancer's done?
Well, I think it's spread to my bones.
Mm-hmm. And have you discussed any further treatment options with the physicians? Maybe surgery,
Well,
radiation therapy?
no, not that. Just that they were going to give me some morphine for home.
Okay.
Yeah.
Okay. Okay. Going into treatment options, I'm not sure exactly what their intention is from this point on. However, what I want to try to do with you today is try to make this process of dealing with the pain as easy as possible for you.
Okay.
So, do you have any questions in regards to using the morphine for pain?
Well, just like I said, I don't want to become a drug addict, but I need
course.
something for the pain for
Of
sure.
course.
And I'm willing to try anything right now.
I just want to switch gears on you for a second. Do you have any allergies to any medications?
No. I am allergic to Tylenol number 3.
Okay. And now, what happens when you take that medication?
I get a stomach upset.
Okay. You don't get any sort of rash,
No.
hives,
No.
no difficulties breathing,
No.
anything like that?
No.
Okay. Now, what that suggests to me is maybe it's not as much of an allergy as it is an intolerance to the medication, which is quite common with that medication. It can tend to upset the stomach quite often.
Yeah.
Have you noticed any negative effects with the morphine so far? Any stomach upset?
No, nothing.
Okay. Okay. So it seems like it's been pretty effective for controlling your pain.
Oh, yeah.
And
yeah, it
I'm
works
happy
good.
about that. Okay, so I understand your concern in terms of not wanting to become addicted to the medication, as you said. I don't think that should be your major concern at this point in time.
Okay.
I think as long as you work diligently with us to ensure that your pain is well controlled,
Yeah.
and we'll keep an eye on and make sure whether that you're not dosed too often, and you're not becoming addicted to it, which I don't anticipate. As I said before, a dependency may happen, and you may notice that.
What do you mean by dose too often?
Well, we just want to make sure that you're not that your pain's adequately controlled without over medicating you.
Yeah, but I just want to have something that's going to work.
Mm-hmm. Of course. Just want to. Right. Thank you.
All right.